Hello, everyone. This is Dr. Sarit Avraham, and in this part, we can't avoid talking about the use of oral hygiene as a very important part of the process of strengthening your teeth, gums, and the implants you have in your mouth. Our hygiene is a very, very important foundation, not only for our oral health, but also for our overall health. Pay attention. For those who don't know, the bacteria that accumulate in our mouths, if we don't clean them properly, not only cause damage inside our mouths, but can also cause harm to our digestive system. If there's a large amount of bacteria, we end up swallowing them, and they can enter our digestive tract. Combined with unhealthy habits, these bacteria, even if they pass through the stomach, which is a highly acidic environment designed to kill most of the bacteria that enter our bodies, if our habits are not good, the acidity level in the stomach is relatively low. It gets compromised, and then those bacteria can penetrate our digestive system, cause disruptions, lead to the growth of disease causing bacteria, trigger inflammatory storms in the body, increase diabetes, blood pressure, and all kinds of diseases. There are many, many studies that talk about the connection between dental plaque and other medical problems. And believe it or not, there are also studies from the last decade that discuss the link between the plaque that accumulates in our mouths and issues like the deterioration of our brain, whether it's Alzheimer's, dementia, and other problems, other additional ones. So, of course, one of the very first things you want to do is make sure these bacteria aren't going to destroy your teeth, your gums, your implants, and certainly not your body. And most importantly, not your brain. Because there are many people who enjoy excellent health, and then suddenly, out of the blue, and we all know these cases, their brain starts to deteriorate, their cognitive functions decline, neurological functions as well. And if you really want to prevent this from happening to you, one of your most important efforts should focus on preserving your teeth and maintaining good hygiene. Now, in these studies, I want to emphasize one particular point. They talk about the connection between the formation of bacteria, plaque in our mouths, but they don't discuss the additional link that happens here, which is that if this plaque destroys our teeth, it's not just that we're swallowing bacteria, but we're also swallowing food that isn't properly chewed. So not only are we introducing something harmful, but we're also not able to get the most out of what we need to benefit from, which is essentially our food. If we don't chew well, our digestive system is affected as a result of the destruction of teeth and gums and all sorts of things. So basically, we won't be able to chew our food properly. And as I explained to you in other parts of this course, that means we also won't get the things we need to balance the system, okay? So it's super, super important. And not surprisingly, this knowledge and understanding was also recognized by ancient medical traditions. Okay, we know that. In Ayurvedic medicine, there's a huge emphasis on how to clean the mouth, whether it's through techniques we'll talk about that are a bit out of the ordinary. But one of the main things is, of course, cleaning the tongue. Anyone who's gone through detox processes and healthy lifestyle changes knows that cleaning the tongue and teeth is a very, very important part of body cleansing, strengthening, and health. And for those who haven't, now is really the time to get to know this. So, I don't want to talk to you about the usual things like brushing your teeth, but rather give you some tips that I give here in the clinic to our dental hygienists to pass on to people. I know that the tips I'm going to give you aren't obvious ones. Most people don't know about these things. And even when I train experienced dental hygienists here, most of them discover new information. That means I'm mainly going to give you tips about things you don't know. And I really recommend you pay attention to this part. And even more so, we're going to go into more detail. Here we have our cute model, the dental model that most of you are familiar with. I got it as a gift from one of our hygienists not long ago. And I want to give you a few essential tips about proper oral hygiene, specifically concerning your precious teeth. In another comprehensive course, if you are mothers or grandmothers and you genuinely want to know the best methods for how to effectively clean little kids' developing teeth, which is also incredibly and profoundly important for their overall health and well being, we will also provide some valuable tips about their crucial dental development and a few other things. So, Of course, you should keep following us because we're going to provide a lot of important content that relates to the developmental aspect of teeth. Right now, we're in the basic course. We'll actually go live once we finish the basic content of this course, most of which already deals with the mature and developed dentition. But as follow up content that you'll get here, like I told you and promised, you'll always receive very honest content here. Thank you. You'll also get key points about the developing dentition, okay? But let's focus right now on points you can apply yourselves. Some of the things I'll mention are also relevant for your little kids. Okay, so here are the main things, all right? One of the main mistakes I see happening, and here I want to give a tip specifically to the dental hygienists watching, and of course to people so they know what they should expect from their hygienist, is that when you go for cleanings, you get some kind of instruction from the hygienist. She tells you to use this brush with this tip, with these brushes and this or that size between the teeth, with this dental pick. But actually, one of the things I've noticed over the years as we treat people, I'm a doctor with a very strong motivation to see my patients healthy and for them to always come here in great shape. And that's something that's really, really important to me because nothing makes me happier than seeing healthy gums in people and knowing that we've taken them through a process and brought them to a point where they're truly strong and stable and they don't need us anymore. That's what it's all about for me. The most important thing and the most meaningful service we can provide for people. So over the years, I really talked to hygienists, explained to them what I think they should emphasize, tried to understand how it can be that we explain to people what they need to use at home, and yet they keep coming back to us with the same issues. We gave them a list of things they can use at home, explained what they need to do. They already know. And still, I'll let you in on a secret. Actually, the people who come to us as patients are highly motivated individuals who want to enjoy a much better life. That's the big gap. These are health conscious people. These are people who, if we tell them what to do at home, they'll do it. And if we ask them, are you using it? Yes, I'm using all the tools you gave me. So, how is it possible that they still come in with layers of plaque? And I remember there was one evening a relative came to see me that morning, and I just went to bed with this feeling. What more can we do to help people? To get to a point where they're using what we give them and it's actually effective for them. Because it can't be that we explain and they really go home, put in the effort, and do it, but it's still not effective enough. And then I really had an insight, and I started teaching the hygienists here as well. I explained and realized that actually, when a patient comes to us, they sit down in our chair. When they sit down in our chair, what do? We take a mirror, we move their lip, and we direct our light from above. And basically, we can see what's happening inside this cave, this gray cave, because really, our mouth, our oral cavity, is a pretty dark and shadowy place. And even if I try to see something in someone without all the visual tools I have, the visualization tools, then I also won't really be able to see anything. What's happening inside the mouth? And then I realized that we have to provide patients with visualization tools so that they can see what's going on inside their own mouths in a way that is better and then perform their home care more effectively. So now we're basically going to talk about a few things. I really delved deep, thought about it, and realized that when you go to clean your teeth at home, you stand in front of a mirror, which is usually in the bathroom. When I looked and examined the bathrooms in several different homes, just so you know, I often like to get down to the details to really research and understand how I can deeply grasp what's happening with my patients. It kind of reminds me of when I was a student and there was that show House. He would go into people's homes, investigate, and see what's going on with them to understand what caused their illness. If you know that show, that's exactly how I often try to really go deep and understand okay, when someone is at home, what's actually happening with them? And then I noticed the following. Most bathrooms actually have very weak lighting compared to the lighting in other rooms in the house. And so when you're standing in front of a mirror, and if that mirror is far away from you, It's also really, really hard for you without enough light and without being close enough to see what's going on inside your mouth. Now, there's something very tricky about trying to clean your mouth. The problem is that plaque, which is basically the layer of bacteria that builds up on our teeth, is by itself, and our teeth are usually a pretty similar color. And if someone's eye isn't skilled enough, or they don't have sharp enough vision to see the difference between the plaque and the tooth, they can't really clean their teeth effectively. That's when I realized how important it is to actually give people tools that help them see better. Because even people who wear glasses, their visual sharpness still isn't always enough. Thank you. It's still not good enough to distinguish between the different shades of white because, let's face it, different shades of white pretty much look the same. And for people who don't wear glasses, all the more so, they don't have any tool to help them see more sharply. Even if their general vision is fine, most people's visual acuity declines with age, and of course, we see a deterioration in sharpness of vision, especially as people get older. Or suddenly we see people over the age of 60 experiencing a decline, and then they're already approaching cataract surgery. But it takes time until they actually get there. It usually happens more around age 70, 70 and up, when they have the cataract surgery. But we do see a very significant decline in visual acuity, and therefore also a very high accumulation of plaque. We see this even in younger people, so don't be mistaken. So I started thinking to myself, what are the things a person needs in order to see better while they're brushing? So the first thing is, of course, better lighting in the bathroom. So you can either just switch to stronger lighting in the bathroom or put up the spotlights in the area of the mirror where you brush, and then you'll get better lighting. Okay? So think about lighting. That's the first thing. The second thing is actually to look at what you see. What did I tell you? When a person sits in our chair, we immediately see what's going on with them because we simply part the cheeks and lips and we see what's happening inside their mouth. Now, I want to show you the next thing. I'm going to brush right in front of you. Here's one more thing. I'll say this beforehand. It's also possible to take a small mirror like this and brush closer. Okay? And then when you brush, you do it in front of a mirror. Now, you might say to me, wait, but how am I supposed to do this in front of a small mirror? I need the sink, right? So, in a moment, you'll see why I don't recommend brushing with toothpaste. Not just me, but also research in the field doesn't recommend brushing with toothpaste, and how we can use toothpaste more effectively. Okay? So, we suffered a little, but we'll get there. Now, look at me. I'm going to brush my teeth. So, this is something you should never do, but I'm going to use it. I'm going to use my toothbrush, which is the same color. I just really love this style. And as you can see, here's a little tip from a dentist. I have a toothbrush almost everywhere. I have one in my bag. I have one in the drawer here in the office. I even have one in the drawer in our dining room. I have toothbrushes everywhere. We'll talk about that topic too. But let's say I want to decide to brush right now. I can actually see what's going on with my teeth, up to where my lips let me, right? So which teeth can I see? I can see up to these teeth. And now, beyond this tooth, I have four more teeth, three molars and one premolar, that I just can't see this way. So I can see the brushing. In my case, I'm simply a dentist, so I'm skilled enough. Or there are people who are just really pros at brushing. But most people, because they can't see well enough, and they do need to see what they're doing. So basically, the back part, you see the head of my toothbrush is in an area where I can't see it, okay? So there are two ways I thought maybe you could deal with this situation. One, as I mentioned, is to take the finger of your other hand, the one you're not brushing with, and pull your lip aside, okay? And see if suddenly you can see more teeth, right? I'm pulling it aside. So now I can see, and now you can also see my teeth really up close, right? So here I'm placing the brush, and now I know exactly because the emphasis is on placing the toothbrush at the neck of the tooth. Let's take a close look here. Basically, we have the pink part, which is our gums. Here we have the neck of the tooth and the crown of the tooth. Okay? Now, where does plaque usually accumulate? It doesn't accumulate between the teeth in this area, between the teeth, and it accumulates at the junction between the gums and the teeth. Most of you probably get instructions about this from your dental hygienist. And if not, tss, 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 go get instructions from your hygienist or go to a hygienist who will actually teach you. Now, how do we know if we actually brushed there or not? Because if I just put the toothbrush in like this, I don't know if I touch the back teeth. If I'm brushing, I can't see it. I can't really see. So what I do is I open up the area and then I can see. Okay? Now, there are people who tend to clench. And by the way, this really affects the position of the teeth. They're very tight. Notice when your muscle is really, really tense, that means you need to focus on relaxing, okay? You have an exercise you need to do, and that's to relax. We'll see these people when we work. They'll have a really hard time sitting in the clinic chair. They're always doing this. By the way, this also creates wrinkles on the face, so you need to learn how to relax, and then it will be easier for you. You won't be working against resistance. You do this, and after you've relaxed the muscles here, and if you tend to clench your muscles, right? You can brush, okay? Now, there are people for whom we even recommend a lip retractor, and for some, it's a bit easier. Actually, the finger method was invented after we tried the lip retractor and saw that for certain people, it just doesn't work, okay? And this retractor is really simple to use, but like anything, it takes some skill. So if you're experts in healthy lifestyles and you like to learn and try new things, then you can also use something like this. Notice how it helps me. Yeah. Now, call me, my comment is suspicious. I'll be responsible and let's see exactly how I brush. Yeah? Yeah. Now, this too, it's an amazing tool in my eyes for retracting lips and cheeks because you can really see what's going on in your mouth. You can see what's happening in your mouth, and you basically become your own number one caregiver, not just for home care, but also to check and see if there's something that means you need to run to the dentist and get it treated. So now we talked about visualization. First of all, opening up the cavity. This cavity is gray, it's lacking light, so we open it up. The second thing you can use, basically, is if you've done what I told you and it's still not enough, if you still go to the hygienist or the dentist and they tell you that you still have a high tendency for plaque buildup, the second thing, and we'll add it to the screen here, is actually to use a plaque indicator. Wait, before we basically, these are little bottles. Usually they come in much smaller bottles. We just bought a really large quantity of plaque indicator here. That means it's a solution that plaque, and then you can quickly see the difference between the color of the tooth and the plaque. It doesn't stain your teeth, and you also don't need to worry about it staining your fillings, unless the filling is just made incorrectly, in which case it just needs to be polished, and then it won't stain it anymore. So if you have white fillings in the front and it stains them, then you just need to go to the dentist. That's why if you have a plaque indicator and you have a filling in your front teeth, we usually recommend first seeing a dentist to make sure the fillings are in good condition so you won't have to walk around with all sorts of pink stuff in your mouth. That said, I can tell you that we've tried this on a very wide range of patients. And even in people with fillings, even fillings that aren't the best up front, fillings done elsewhere, the plaque indicator was still effective and efficient for cleaning, and it didn't really stain their fillings much. So you don't have to worry about that, but it does stain tartar. That's why I wouldn't start using the plaque indicator before you're sure you don't have tartar in your mouth, because then the staining won't go away, okay? Now, tartar builds up after a period of between 2 and 14 days, depending on the acidity level in your mouth and various other factors. For example, in my case, tartar can build up within a single day, okay? I just have a very strong tendency to secrete calcium through the salivary glands, and there are other people like that too. So it's all very dynamic. So the plaque indicator is simply something we use here for people who we see that even the basic visualization aids didn't help them, and they can actually stain their plaque. You can see here in different colors. What's nice about the specific plaque indicator shown in this picture is that it's from a special company. The plaque indicator is very expensive. You don't necessarily have to have it, but you can get a demonstration at the dental clinic to see. because the different colors actually show different types of plaque activity. And the lighter areas indicate bacteria that cause diseases in the mouth, such as cavities, gum problems, and so on. So, this also serves as a tool to help us know how active the bacteria are in your mouth. So, this is another visualization aid you can use. What we did here at the clinic, because it's really, really hard to get the plaque indicator just like that, at first we used to recommend it to people, but we saw they couldn't get it. So, we just bought a stock of it and we give it out here at the clinic in small portions, each person according to their needs. And they can use it at home. So, you can try to see if you can get it through your own clinics. Another option. But before that, I just want to give you a few tips. If you have lime scale in your sink at home, when you use the plaque indicator, you'll obviously rinse it into the sink. And if you have lime scale there, it will also stain the lime scale. So, first of all, this is a good opportunity to see just how clean your sink is. And don't be alarmed by it, okay? So, I do recommend maybe rinsing into the toilet or something else so you don't have to worry about the cleanliness. You can even use a cup. Everyone eventually finds the way that works best for them. At the end of the day, this is a tool that can really improve your oral health, and you just need to find a way to use it effectively, consistently, and not in a way that's unpleasant. So, we can also address this with a lot of important points on this topic. Now, another important thing we can effectively use, I'll clearly show you. We've actually meticulously created a comprehensive kit specifically for the patient, which thoughtfully includes a highly visible plaque indicator, the comfortable lip retractor, and the gentle cheek retractor, and also a very useful dental mirror, complete with a bright integrated flashlight. I'll find it and show you the kit. The kit itself, later on, I'll send you an ad and we'll make a separate video about the kit itself. So, in this part, we basically talked about the fact that you just need to see what you're doing, okay? Most people, and we'll see this especially in people who tend to bite their lips, okay? If you notice that you're trying to use your finger to pull your cheek and it doesn't really open, but you feel some resistance, thank you. You're probably among those who are more at risk for this, meaning you won't be able to see what's happening in the further back parts of your mouth, and that's how people lose their teeth. That's also why, in most cases, the molars are the first to get damaged, among other reasons. There are other things too that harm and put a lot of strain on our back teeth, but this is truly one of the things you can significantly improve with proper home care. Another thing is that, of course, many people brush with a regular toothbrush. Now we're living in an era where we know that a regular toothbrush isn't the only option. We have electric toothbrushes as well. The difference between a regular toothbrush and an electric toothbrush is huge. So I'm already going to give you a very important recommendation. Use an electric toothbrush, not a regular one. I only use a regular one on Shabbat. Or actually, as you can see, I do have a regular toothbrush, so I use it during the day. But at least one brushing during your day, whether that's in the evening or whenever. We talk about the timing of brushing and the full brushing. There are brushings during the day that are lighter, and then I'll use a regular toothbrush because an electric toothbrush just takes a bit more time. But if you really want to break up the plaque that builds up and accumulates much faster than we see or think, then the better way is with an electric toothbrush using circular motions. The circular motions of the electric toothbrush break up the plaque much faster and give us a much more effective brushing in a much shorter time. Okay, so now when we're brushing with a regular toothbrush, if that's what you have, we position it between the neck of the tooth and the tooth itself, like we talked about earlier. And we go over the same areas several times, okay? So count 1, 2, 3, 4, 5, 6, and then we move on. Of course, we do this in all areas. You can combine it with a circular motion like this, and then there's this pointed tip. You don't have to buy this particular brush. There are just handles for these tips as a handle on its own. And we often also recommend another handle like this. We'll see it in a moment, which certainly allows us to clean the neck of the tooth more effectively using this tip, okay? and also a bit between the teeth, in that triangle between the teeth. Let's get a bit closer. Great. So here we place it here and clean. Okay. Excellent. So we do this both on the outside and, of course, on the more inner parts of the tooth, where the tongue touches both the upper and lower teeth. So this is really just simple manual use of a toothbrush. I want to emphasize the use of an electric toothbrush. A lot of people use an electric toothbrush incorrectly because, as you may have noticed, with a manual toothbrush, we use it with motions like these. With an electric toothbrush, the common mistake people make is that they turn it on and then clean their teeth in the same way. They turn it on and clean, just like they would with a manual toothbrush. This is also something I've noticed over the years, and I ask people, wait, are you using an electric toothbrush? And I don't understand how their teeth are still so unclean. Then gradually, what we noticed is that we ask them to bring in their toothbrush and show us how they clean their teeth. So, what we do with an electric toothbrush, because it has that rotating motion, is that you need to let it sit on the tooth and let it rotate there. Let it sit and give it pulses. One, two. It's an action that's a bit more boring, supposedly, because you don't need to do much. You don't need to move, you just need to be aware and let the electric toothbrush sit, do the rotation, and make sure it does enough rotations on each tooth itself. Now, even with this, sometimes it still wasn't enough for some of the people who come to us, and it also really depends on the structure of their teeth. Another tip I gave to the hygienists is that even though we place the electric toothbrush on the tooth, with molars, often in reality, the tooth and its surface are larger than what you see on the model here. Actually, the head of the electric toothbrush isn't really the size of a whole molar. So, what you need to do is focus on the back part of the tooth and then on the front part. I'll do like this, and like this, and like this, and like this. So, basically, we also need to get, let me just add, this triangle between the teeth, because people will clean well with the brush here when they move it in a circular motion on the tooth. But this part, this triangle, will stay full of plaque. But when we actually do this movement, again, it's not a big movement, it's a very small movement. We're just sitting on this part of the tooth and then on the other part of the tooth, on one part of the tooth and then on the other part of the tooth. Thank you. And then, with proper technique, we can truly get the absolute most out of all our precious teeth. You will clearly see that we'll achieve the maximum beneficial effect from using the electric toothbrush, okay? Now, another important point is, of course, between the teeth. A lot of people brush nicely on the outside, but between the teeth, in the area that's between the teeth, here we have another model here, they miss this part, okay? So, our focus is really that we need to use some kind of cleaning aid, and I say some kind because there are all sorts, to clean between the teeth. Now, if you use dental floss, usually, especially for adults, it will mostly be suitable for the front teeth, our incisors, and it won't be enough for the back teeth because of the shape of the tooth. And what? The part where the teeth meet, okay, so, usually, we don't recommend that adults, and yes, kids, we'll talk about that in a moment, use only dental floss. There are certain types of dental floss, of course, like the kind you wrap around your fingers and use. I can, while I'm talking to you, show you what I actually do. Pay attention. I even It's really, really convenient, okay? So, what happens is that I actually use this throughout the day, even if it's a bit less effective than the brushes I'm about to show you, because it's just so convenient and easy to use. So, let's say I'm typing now. After I've eaten, notice I don't even need to look in the mirror. Once you develop the skill, you just pull out this tool from here. You just get rid of the food leftovers. Because if you're at a high risk level, and if you constantly have cavities and problems with your teeth and gums, you're probably at a high risk level. You want to have these tools ready at hand, and you'll be surprised. You don't need to clear anything out, you just need to be aware, to have it right in front of you. I put some kind of box in front of me, and I pull out the next tool I want. If I want, I can even just use a chair. While we're talking, pay attention. Let's say we just finished a meal. It's a social meal. Notice how quickly I cleaned my teeth. I can even just use my brush to get rid of the stuff. I don't even need to get up and go to the sink or anything like that because I don't use toothpaste with the brush. And if I've made you curious, hold on tight. We're going to talk about why I don't use toothpaste while brushing. So that's basically the topic. Now, I really, really, really recommend this to you. Ask to come with all your brushing aids, with everything you use, whatever was recommended to you, and sit down with the dental hygienist. In our clinic, we usually do it this way. When someone comes to us for the first time and we notice they have a very high amount of plaque, we recommend, of course, no one is obligated to do anything, but we recommend having a double session with the dental hygienist, not just coming for one. Just for a hygienist treatment. We'll talk about how we prepare the mouth before dental treatments, both before a dental procedure and as a preventative measure. But also, when you come to our clinic, our first recommendation is to see the hygienist, get on the same page, and come to the treatment prepared with a cleaner mouth. Because if you come in and your mouth isn't clean enough, we'll talk about the consequences of that, but I don't want to overload this video with that information. There are some very, very important things about it. Now, when you come to the hygienist, one of the things I sat down with the hygienists and taught them is that we don't just explain to you verbally what tools are being used. Instead, you'll have this video where we give you the tool, you demonstrate to us yourself how you use it, and then the hygienist sits with you and gives you personalized advice and points out specific things like what you might be missing and where to put the most important emphasis. Another thing we do is we don't give people a list of little brushes. If you've been there, you probably often get a long list like that from the hygienist. Use the red one here, the green one there, the blue one over here. So basically, we don't give theoretical lists. We actually sit down, and if you're a hygienist, please listen carefully. We sit down with the patient. And we explain to them, we show them, we have a special kit with all the possible sizes of interdental brushes, and we measure together with the patient to make sure that the size they're using is the right one. Because there are all kinds of brush sizes. I showed you one size here. This is a silicone chair. But there are also brushes that are like little bottle brushes that go between the teeth. We match their size according to the space between the teeth for each and every patient, because in different areas of the mouth, you need different brush sizes, since the gaps are simply different sizes. If we use a size that isn't effective enough, then the patient will keep suffering from all sorts of problems. And it's really very simple. It's an amazing service for the patient because instead of you having to guess what size they're supposed to use, thank you. We created a special kit. We took all the possible sizes and made a small set where the hygienist can sit with the patient, try them out, and even measure for them. Then, when she writes down which sizes of brush the patient should use, they can actually use the right size and take care of their mouth more effectively. So, as we said, we brush the outside and we also brush between the teeth because that's really where the most plaque builds up and it won't clean itself. Now, I actually told you that I don't use toothpaste while I'm brushing. And that's for one reason we've already talked about. The toothpaste doesn't let us see where we're putting the brush because then the mouth fills up with paste and you just can't see. So, one of the problems is that people can't see what they're doing because their mouth is full of toothpaste. So, how can they see where they're putting the brush? So, we separate between the effect of mechanical cleaning, which is done by brushing, and first we clean the teeth mechanically. At the end, if necessary, we recommend using chemical cleaning, which is done with the toothpaste. Another thing that studies point out as a problem with using toothpastes, there are all kinds of things they can indicate, depending on the brand and the type of toothpaste, etc. But the issue is that many of the big toothpaste manufacturers use numbing agents, meaning substances that slightly numb the gums. On one hand, their intention is good because many people with gum inflammation experience pain when brushing. So, to reduce the pain and allow for better brushing, it's more effective, of course, to numb the area of it. So, we'll talk about how we can numb more effectively. But the additional problem is that when we numb the gums, we also numb the tongue. These substances prevent the tongue from acting as a sensor for what's happening. In our mouths, because the tongue, with its rough texture, first of all, it has a cleaning effect on our mouths on a regular basis. And people whose tongues are not tied, pay attention. People with a tied tongue won't be able to do the following. But people whose tongues are not tied can constantly clean. Let's say my finger right now is the tongue, but they will run their tongue over their teeth all day long. It's kind of a habit. They just clean that way all the time. Their teeth, they won't let dirt build up too much. And we see in people with a tied tongue or an underfunctioning tongue a greater buildup of plaque and problems inside the mouth. And there's actually a lot of discussion about this topic. We'll dedicate a separate course just to the subject of underfunctioning tongues and tongue tie. It will be beyond the basic course, included in the advanced content. So, again, a little patience. We have so much to learn, and we'll get there. Now, as I told you, I actually separate between mechanical cleaning, which is the use of brushes and all the interdental brushes, and chemical cleaning. And that's because we live in a world where we're always looking for instant solutions. We want things to be as quick as possible. But in reality, we're often missing the point. Because when we want to get the full effect of brushing, we can never really achieve it if we mix chemical and mechanical cleaning. Like I told you, the toothpaste fills up your mouth. You can't see what you're doing, and you also can't feel with your tongue because it's coated and can't detect if there are any leftover bits of dirt on your teeth. So you lose your sense of touch with your tongue, and you also lose your sense of sight with your eyes, since the foam just gets in the way and you can't see what's going on. So do it dry, and you'll see that the mechanical part of the cleaning will be much more effective. Now, toothpaste isn't just for nothing. We actually want to get the chemical effect from it as well, part of which is an antiseptic effect, meaning it cleans out the bad bacteria from the mouth. It can help people who tend to have a higher buildup of plaque and tartar. We'll delve into this topic in just a moment. But for now, let's assume we've thoroughly cleaned our teeth mechanically. And at this point, we genuinely want to achieve an effect that significantly strengthens the overall teeth structure. For example, I often recommend to patients to use the toothpaste itself after they've finished thoroughly cleaning their mouth, and then use the small brushes to apply the toothpaste exactly to those tiny areas where bacteria can accumulate and hide. And not to rinse the mouth, but to let the toothpaste stay in the mouth as long as possible and be absorbed into the teeth. We'll talk about the fact that the real issue in our mouth is that anything we put in, we can't use toothpastes to get the full chemical effect of strengthening the teeth or gums, because naturally our mouth is constantly being rinsed by saliva, by the fluids in our mouth. And so basically, if we see that, and so we recommend using these toothpastes inside these special trays. And here you can see a model of a patient's teeth. And we made trays for her because we saw that she has a tendency to constantly develop cavities. And of course, we'll talk in a separate episode about using these strengthening trays, and we'll put the toothpaste inside the tray. The tray allows us to get the full biochemical effect of the material because it actually prevents the material from being washed away. It also allows the material to really penetrate well into the tooth and enables a slow release over time, at least 20 minutes or half an hour. This way, you can treat yourself at home and get a very significant and important preventative effect. We'll talk about these trays separately, but let's say you don't have these trays and you still want to get an effect from the toothpaste. What you can do is put the toothpaste on the little tools you use, whether it's a silicone toothpick or the interdental brushes we talked about, and insert the material. Just dip it in the toothpaste and insert it between your teeth. Spit, but don't rinse. That way you get the full effect, because if you brush and then rinse, the material doesn't have enough time to work. There wasn't enough time for the material to penetrate the tooth. It's true that there are companies like Colgate that claim they make their toothpaste with a special polymer that can stick to the tooth and stay on it for slow release. But in practice, I see that it doesn't give enough of an effect. If we want to achieve slow release, we need to do it in different ways than usual, which I've just detailed here in this course. So I've given you a ton of tips here. We've already spent over 40 minutes just talking about how to clean the mouth. The last thing we'll cover in this section will give more tips for kids and all sorts of other things. So hang on, don't worry. It's about cleaning our tongue. The tongue is very, very rough, and some people even have grooves in theirs. So just scrape it and clean it properly. There are special tongue cleaners you can buy at the pharmacy, but you can also just take a regular spoon that you eat with. Use the backside of it. If the spoon is like this, you use it like this and scrape your tongue. Because on that rough surface of the tongue, a lot of bacteria, fungi, and all sorts of things can accumulate, which are also harmful to our health and to the teeth and gums as well. So remember to always clean your tongue well too. So this was really a very, very important episode. I'll also give you some super important points that can really help you make significant progress, both in terms of your oral health and your overall health. Like we said at the beginning of the video, cleaning your mouth is actually a very important foundation for our general health. Thank you. Because if our mouth is full of plaque and oral bacteria, you'll end up swallowing those bacteria. They'll get into your digestive system, disrupt its function, and in other ways can also cause hormonal imbalances, diabetes, vascular and nerve diseases, and all sorts of other things, even cognitive decline, brain issues, dementia, Alzheimer's, and various other problems. Like I told you, there are so many things that are in our overall health that are connected to what's happening inside our mouths. And you definitely want to be aware of them and take significant steps to improve your own health. So, I really recommend that you, although I didn't emphasize this, but in other videos I do, and I'll try to make a point of it, take a piece of paper and a pen and write down the things I'm telling you, including the plaque indicator, including the visualization tool, and so on. Start a notebook for yourselves and write down the things I'm saying, and that will really help you to keep making better progress all the time. And of course, if you find value in the videos we're giving you here in the course, invite as many people as you can, because we're about to create a really, really significant health community here to help a lot of people save a lot of money on dental treatments. We're going to improve the health of so many people right here to help you achieve a much higher quality of life and longevity. We talk about this a lot here in the course. I'm happy to connect with you here in this episode as well. Dr. Sarit Abraham and the wonderful team of experts at the Yoshalem Dental Clinic.